We are continuing focusing on health on our show today, and right now we are going to hear from Dr. Eileen Gallagher as well as Sarah King and Allison Rhoads. Dr. Gallagher is opening a new pediatrics office here in Park City. The three of them are joining us via FaceTime. Thank you for being with us today.
Thank you for having us.
So, Dr. Gallagher, let's start with you. You are opening a brand new practice in Park City. Tell me more.
Well, I've been here in Park City for a few years and have been thinking about opening my own practice for a while. COVID obviously threw a wrench into lots of people's plans, including this, but I think it's even more important now in this post-COVID age that we have lots of opportunity and many different ways to access great pediatric care for our kids. So I'm here to help provide that to the community.
Now, you've been practicing medicine for over 20 years. Exciting that you're opening your own practice. But during this tough time, has it been hard opening during COVID-19?
Of course. I mean, so many businesses are struggling and people are having difficulty with access to small business funding, etc. But it's been interesting. We actually really changed our business model as a result of COVID. So rather than having a typical very large medical office with a big waiting room and lots of rooms, we actually have opted to dial it back a little bit. And so we have a small office, makes it a lot easier to keep it exceptionally clean. We have car visits available in the covered parking garage here at New Park, and we don't really have a waiting room. We ended up choosing a electronic medical record that has a texting platform so that patients can text when they arrive, and then we can tell them to meet us at the front door, meet us at the back door, get them quickly into a very clean room, and then out afterwards, and that way it's an especially safe place post-COVID.
And Sarah King, you're an RN. You've been working with pediatrics for over 11 years. How does it feel to be opening up this new practice?
It's a total change from what I was doing before, but it's definitely something that I've always wanted to do, and I'm just really excited to learn how everything works from the very beginning. So it's been really cool.
What are you looking forward to the most? I know it's difficult during this time. It's a whole different way of seeing patients, but as you open those doors and start to see some children, what are you looking forward to?
I'm really excited to just get to build some good relationships with the patients and the families. I come from the emergency world, so I love that, but you kind of meet some people briefly and then they move on, and in this setting I get to really build some cool relationships and watch kids grow up and help be a part of their health and their growth.
And Allison Rhoads, what will you be doing at Gallagher Pediatrics?
So I'm also running the front desk, and then once I get my certification finished, I'm working on it right now, I will be doing a little bit more clinical work, so a little bit more in the back, working with the patients with Dr. Gallagher and with Sarah.
And tell me, what made you decide to work in pediatrics?
I was a lacrosse coach, so I grew up in Park City, and I worked for Basin coaching lacrosse camps for a while for little kids. And then I went to school in Montana and coached skiing there for little kids, and turns out I just get along with little kids really well. I may or may not still be one, so I thought it'd be really fun, and I might want to be a doctor. I think I do, so this is kind of the first step in that.
Dr. Gallagher, it looks like you've assembled a really great staff for your practice. What are some goals that you have as you embark on the first few months of being in this practice?
Well, we're really looking forward to providing community care, and so we've already reached out to the school nurses. We want to be working with them during this very challenging year of getting kids back to school, but in a safe way, and making sure that they have the ability to have outpatient follow-up if they get sick or someone in their family does. We're looking forward to working with Park City Hospital and providing another person who can see kids in the ER and see new babies and provide that continuous transition from a well baby to your outpatient pediatric care to if you're sick, needing to go to our local hospital. And then I have been a volunteer at People's Health Clinic, and so right now we're dealing with a lot of people who don't have insurance, and so we're looking forward to coordinating with Beth Armstrong and the others at that great clinic so that if people do lose their insurance or don't have insurance now, they're moving back and forth from insured to uninsured, we can make sure that they get great care in several different settings.
And you also emphasize not only this continuous care, but also care that is available around the clock through texting and calls, and really bringing that personalized part of medicine back into your practice.
Right. I think that medicine is being challenged by COVID here in the United States, and COVID has revealed a lot of weaknesses. And one of the weaknesses is that people sometimes have trouble reaching their doctor or getting an appointment. And we need to get back to old school medicine where your doctor is your available consultant for your questions, your concerns, your fears, and then for those illnesses. And so that's a primary underlying goal of this practice.
And I'm sure you're very grateful to have Allie and Sarah join you. What are some reasons that you chose them to be a part of your practice?
Sarah has amazing experience taking care of very sick kids and chronically ill kids. She's also worked as someone providing home health care for very ill children and in the school setting. So they've already hooked up with the school nurses so that we can hopefully do some collaboration there. And so it's nice to have someone with both amazing clinical expertise and an interest in doing the community care. And Allie's going to do great. Allie wants to learn all the different aspects of office work and clinical care. And so we'll see where she takes this starting position someday, but who knows whether she'll be running her own business as a doctor. We'll see, but we're going to get her started and continue her relationships in the community and provide you with a great office experience.
And how can we get more information if someone wants to make an appointment? What should they do?
Well, if they want information, our webpage is pretty robust, and that's at GallagherPediatrics.com. You can also call anytime to the phone number, which is 435-602-0187. And when patients come by the office, people have been either calling or stopping by, we can set you up with our registration materials and get you started. Once you're in our office, in our practice, we do have a patient portal, so it'll be really easy for people to email and book their own appointments and reach out to us for issues that may seem minor, but to them and really aren't, or it may seem minor to us, but it's still great. So you'll have lots of ways to reach us between our portal, our webpage, and our phone number.
Well, Dr. Gallagher, Allie, and Sarah, thank you so much, all three of you, for joining us today. It must be a very busy time opening up a practice here in Park City during COVID-19. It's great to meet all three of you and wish you all of the luck.
Thank you so much.
Thank you.
All right, we'll be back with more on this Monday. Stay with us.